Hello, Allegiant CNAs. Let's go over the difference between objective data and subjective data. Objective data is data that is directly observed by a healthcare provider. It is based on facts and not opinions or feelings. Objective data is collected through observation using your senses. This includes your sight, your smell, and your touch, and what you can hear. Objective data is data that can be measured and it can be validated by another healthcare worker. Remember, objective data is considered a sign. Examples of objective data: taking a blood pressure, a pulse, a temperature, being able to observe maybe a rash on a patient's skin. Subjective data is data that is viewed from the viewpoint of the patient or someone in the patient's life. Subjective data does not have to be proven. Instead, it is based on what the patient feels, thinks, or perceives to be true. Example of subjective data is a patient complaining of pain, discomfort, itching, or nausea. These are all symptoms, and these are things that cannot be measured. We have to trust what the patient is telling us. We have to believe the symptoms that the patient is sharing with us and report these symptoms to the nurse. So we cannot measure pain, we cannot measure discomfort, we cannot measure nausea, we cannot measure itching. This is what makes this data subjective, because it cannot be measured. Subjective data is considered a symptom, whereas objective data is considered a sign. Let's look at an example of subjective data. A patient complains of pain and discomfort in their arm. The CNA looks at their arm and they're able to see there is a rash, a red raised rash present on their arm. The CNA reports this information to the nurse. The information that the CNA reported to the nurse is considered objective data. This is data that she was able to observe with her eyes. She was able to see that there was a red raised rash located on the patient's arm in the area where the patient complained of discomfort and pain. Remember, subjective data is going to be data that cannot be measured. You have to trust what the patient is telling you. Objective data is data that can be measured and it can be validated or verified by another healthcare worker. So in review, subjective data is information given from the viewpoint of the patient or someone in the patient's life. It is considered a symptom. It does not have to be proven. Remember, subjective data does not have to be proven. Instead, it is a report of what the patient feels, thinks, and perceives to be true. Let's review our objective data. Remember, our objective data is information directly observed by the healthcare worker. It is considered a sign and not a symptom like subjective data. Objective data is considered a sign. It is based upon facts and not opinions. Objective data in nursing is part of the health assessment that involves the collection of information through observation. The senses of seeing, hearing, smelling, and touching are used to gather information about the patient. This, my friend, is objective data. And I hope that I have given you a clear understanding of the difference in subjective data, which is data that the patient tells you, is also referred to as a symptom. It cannot be measured. For example, pain, nausea, itching is subjective data. And then you have your objective data, which is data that you can measure. You can use your senses. You can see the data, you can hear it, you can smell it, you can touch it. It is measurable observations that can be validated by another healthcare worker. And examples of objective data is taking a vital sign, getting a patient's pulse, observing a patient that's coughing, observing a rash in an area that a patient is complaining of discomfort and pain. This is the difference between objective data and subjective data. You got this.